We're excited that you're here, and please join to finish off our in-booth lecture series, Dr. Patti Panucci.
All right, good afternoon. I guess I get to bring it home today, huh? All right, welcome y'all. Honored to be here as a key opinion leader for Henry Schein, so thank them very much for inviting me. I'm going to be talking about a new standard of care with AttachLess Aligners. So my goals for you today, I hope you can leave here understanding three things. Really, what it is that makes AttachLess Aligners different, okay? Why AttachLess Aligners are beneficial for both patients and for doctors, and how you can incorporate them in your practice seamlessly, very easily integrate them. So in order to accomplish those goals, I'll be covering several topics. First being the SLX aligner fabrication and design. And I really think this is what's going to answer that what, okay? What really makes these aligners different. And in order to talk about the why, what's beneficial, why is this beneficial to patients and doctors, I'm going to be reviewing patient selection, and we'll go through some cases as well. Then I'm going to talk about treatment presentation to the new patients and aligner delivery, and that's going to help answer how you're going to integrate this into your practice seamlessly. Can everyone hear me okay? Okay, great. All right, so with a show of hands, how many of you are using clear aligner therapy in your practices? Okay. Leave your hands high if you're using SLX aligners already. All right. Excellent. We got one down here. Okay. Great. Wonderful. So my practice, by the numbers, I'm 42% aligners. No, that's not my age or how many hats I own. I actually own a lot more than that, and I'm older than that. But I've been in practice for about, well, my practice has been open for 13 and a half years, but what is 16 for? Oh, okay, graduated 16 years ago, there we go. But I opened my practice from scratch about 13 and a half years ago, and I've been a key opinion leader for Henry Schein now for about 2 years, so little story about myself. So, but back to our agenda. So what is it that really makes the aligners, that allows them to not need attachments? Does not need attachments. And I think it's all in the SLX fabrication and design. So I'm going to spend some time on that. Now, what does attachless mean? You're thinking, oh my gosh, you know, just like I did. You're thinking, oh, it's just like that other aligner product circa 1999, right, when they didn't have any attachments. Well, it's not that. I mean, we still can place attachments if you need them, but it's really in the fabrication and design of this, which I'm going to get into, is really what makes it unique, okay? And I think when you learn that, this is what will allow you to become a little less attached, all right, to some of the other aligner systems out there. That was supposed to be a really fun pun, but I didn't go down very well. Okay, all right. So I love this picture. I mean, this is called harbor mouth molars. That's somewhere in New Zealand. But this is just a great representation of how the fabrication design process starts. It starts with real tooth models, right? So you actually have, you know, the engineers are going to start with one high precision mold. Think of die cast from dental school, right? And so each tooth is then sectioned and placed on a pin so it can allow to move in six degrees, right? Through rotations, through translations. And each tooth is then moved, and along the way, as the teeth are moved, at each stage, another aligner is made. Another aligner is fabricated. So it's not a digital model. It's not a digital design, okay? We're not making resin models, okay? And as these teeth are moved along, as these teeth are spinning and moving, if there are collisions, if these actual models are colliding with one another, they're real collisions. So they're not in the digital world. So when we see this happen, then that's an indication, okay, you're going to need IPR. This is where you're going to need IPR, and this is how much IPR you're going to need. So it's not a guess, and it's not a digital guess. So it's a real collision. And like I said before, we're not creating a series of resin models, so we don't have a lot of waste, to dispose of after making all of these models. So when you take a look here at the two different models, we've got Invisalign on the left, we've got SLX over there on the right-hand side. And what you're going to notice is the edges of the SLX aligner are not scalloped, as you see here. And by leaving that, by leaving those, that material there, it can grab into those interproximal undercuts between the teeth and really hug the teeth. It's sort of a corrugation, if you will, that pushes the teeth into the proper direction, right? And then you can see the material that's used as clear wave technology. You can see how much clearer the aligners are. So here's just a good close-up to see the difference between the two aligners. Yes? No, they're not. It's not straight across. There's a little bit, as you can see, it's just not scalloped interproximally, okay? All right. So we've covered SLX aligner fabrication and design. So I want to move on to patient selection. Here's some pictures of my office. And I think people come to the office, my office, for patient experience. And really what they're looking for is obviously they want aesthetics, right? So you have to have a beautiful office, right? They want to be comfortable. So you have to have areas where they can be comfortable. And obviously they want something clean. And I have some massage chairs in my reception area, and they can view my 65-inch flat screen. I've got Kaleidoscope playing for patient education and marketing. And I just want to do a little plug on Kaleidoscope because I think they're a great company run by great people, and they really do support Henry Schein. And that was unsolicited and unpaid, but I just wanted to give them a little plug. So I think that goes to really, why is this beneficial? Why are these aligners beneficial to the patients? They're looking for those three same things when it comes to aligner treatment. They want aesthetics, they want something that's comfortable, and they want something that's very clean and looks very clean. And so you're going to get that with the SLX aligners. And I think with no attachments, that's going to tend to lend to the clearness, the cleanness, and the comfort. So continuing on to the benefits for patients, like I said, there's better aesthetics because of the clearness in the aligners, as you could see in the previous slides, but also the increased comfort. And patients come, I'm sure you've had many patients in Invisalign that are going to complain about those bumps on their teeth, right? And when they take off their aligner, they are a bit rough, right? And they are not comfortable. But I think even more so than just having the bumps on the teeth is the long appointment to place these attachments. That's just not comfortable for anyone. It's not a practice builder. In this day and age now, with so many do-it-yourself aligner companies come out that are out there, I should say, that don't have attachments on their aligners, people are coming to expect this. And so I think that's where we need to kind of shift our thinking as well. So when I said it's not very fun for the patients for us to place the appointments, well, how many of you out there enjoy bonding attachments? I, for one, can say, heck no, all right? So, I look back and think back, oh my gosh, how many times do I walk over to one of my patients? I've delegated to my assistants to place the attachments, and there's just, so much flash I have to clean off, and I'm just shaking my head thinking I could be spending so much more time with the patients or be seeing so many more patients rather than cleaning flash off of these patients' teeth. Or better yet, what if an attachment falls off a crown? You know how many times that happens. And then you've got to rebond it, and you're going to have extra chair time. And so now, fumes emanating from my nose, right? But the best, oh, the best, okay, the best is you walk over to the patient and you see a beautiful void in an attachment, and you've got to grind it off and bond it right back on again. And that's no fun for that patient. That's no fun for the setting back the, your entire schedule, the entire afternoon. So that's pretty much when the Italian flames start flying out of my head and burning through my hat. But even more so, I think when you have fewer attachments, you spend less time at the computer, okay? And that's when I say I'm clean wrecking myself because, when you have to just sit there and move them around and remove the ones, the 1,700 they've added on there, it's much less time on the computer. So you've got many, many advantages as doctors to move away from the other products there. Oops, skip one. Okay, so continuing on with patient selection, the whole idea behind the whole Sagittal First philosophy is getting these patients to a Class 1 platform, Class 1 with spacing, and that's when these aligners are going to work best. So obviously, if you've got a Class 1 case with spacing, you can take care of taking care of you right there, or with a little bit of crowding. But if you have a Class 2 or Class 3 case, you're going to want to use the Motion 3D first, get them to that Class 1 platform with spacing, and then move on to your SLX aligners. So I'm going to continue and show you a few cases. And I will preface this by saying I'm definitely not the world's best orthodontist, but I do strive for exquisite cases, and I try to learn from the best of the best. So that being said, this is down and dirty, everything out there. This is my 4 first cases. You're going to see everything. This is real experiences, real treatment times, real successes, real failures. So it's all out there. All right, so let me start with case 1. I think this was a very great one to start with. Start in the shallow end of the pool, Class 1 spacing, upper and lower, pretty easy. She came in August. She came in with her husband, and they both wanted to start treatment. So they decided they wanted to get through this as quick as possible, so they actually got an Acceladent to share. So when I go through the treatment time with her, I realized that this is an accelerated case. So she is changing her aligners every 4 days. Okay. The case setup, what you're going to get is what kind of looks like, some study models, and this is what the initial setup looked like. And then her final setup, you can see here, and the areas where some collisions were noted, you can see the areas of IPR with the red lines there on the IPR sheet. So progressing through takes about a month to get the aligners back. So this is her at 2 months in treatment. And you can see this closing, the spaces are closing up. Things are progressing nicely. She still has, great upright incisors, no tipping. Okay. So 3-month progress. At this point, she still has 0 aligners, and I don't see any unwanted tipping in those centrals. So at 5 months here, we took photos and a scan to do a refinement. We still had a little tweaking to do. I wanted to shift that midline on the lower. I wanted to do, finish up a little bit of alignment on the lower as well. The upper arch was pretty much closed. And then this is where we finished her. So, from start to finish up there, she was done in 6 months. Okay. And again, no attachments, beautiful control of those incisors. So, all right. Case number 2. This is her husband. All right. So keep in mind he is accelerated as well. Kind of similar. He had upper spacing, but he also had some pretty gnarly rotations there on the lower left side, and he's missing a lower incisor. So he started the same time as she did. So we took some pictures. So here he is at his 2-month progress. The upper diastema is closing nicely. Still have that little tricky area on the lower left of his, between his lateral and his canine. Okay, and then here we are. I believe this is 5 months in. Yeah, the upper is almost completely closed. I'm getting a little worried there because that lower left lateral and canine are now touching. And I was kind of wondering, well, how is that going to work out? How are those rotations going to work themselves out without any space between the teeth for the aligner to grab onto? You know, especially you know, with the severe rotations he has there. So what we did, went ahead and scanned him for refinement, and we're still working on closing the upper, but changed the plan a little bit so we can open up space between the lateral and the canine, so that now we can get and utilize, you know, the plastic and utilize it so that it can fully express the rotations on that lateral and that canine down there. We're still not finished with him, but this is where he started. I wanted to show you that space in particular, that tricky area down below between the lateral and the canine. You can see how much movement we've had, okay, without any attachments at all. Okay, so he's still in treatment. He's not as compliant wearing his aligners as his wife is, but or using his accelerator, but he'll be done pretty soon. Okay, moving on to case number 3. This was my 4th case. I call this a class 1 div 2. I know that's really not a category, but I just feel like when the laterals kind of tip out a little bit, then those upper laterals, it's got that div 2 appearance. But he's solid class 1 on both sides. He's got some upper spacing and some lower crowding and a pretty big deep bite. And he just kept chipping his lower incisors and kept going to get, you know, those lower incisors fixed at the general dentist. And I said, you know, you just can't keep doing that, because it's your bite. Your bite's the issue. So let's fix it, and then you'll be good. So he said, okay. And let's see. This was his initial case setup. And then this was the final setup. As you can see, there's a little IPR in the upper left quadrant, and then some lower posterior IPR as well. He suspected that. He had upper spacing and a lot of lower crowding, so that's where the collisions were noted, and that's for the setup. That's for the IPR. And so this is 5 months in. You can see the upper spacing behind the canines is closing really well, and we're getting some alignment on the lower. And some spacing actually was opening up in the anterior because of the flaring of those incisors. But what I want you to see here is those upper centrals did move forward quite a bit and intruded even. But the lower incisors also came forward. So we've got this little posterior bite opening, and I want you all to note that, because I think you may come across that quite a bit if you do a lot of aligner treatment, and you may think it's just because there's 2 pieces of plastic there wedging the bite open and opening up the posterior. It's actually not, because it's actually hitting in the anterior teeth. And so you need to get rid of the interferences there in order to allow the posterior bite to settle down. So we're doing that. So here's his 5 months. I just want you to see some of the intrusion in those centrals. And I want you to just also see the control on the laterals. I feel like that's where we all kind of lose control with these aligners, especially even when you have attachments. Sometimes you're losing a lot of the control on those laterals, but everything's working out very nicely. So if we can compare the upper, you can see the spaces are closed behind the canines. And then look at the rotation on the lower left canine, how it's unraveling there without any attachment at all. Okay? Okay. So now that I've gone through a few cases, and I thought, okay, this is great. Everything's going great. I'm gonna dip into the. I'm spinning with joy. Yes, I'm gonna dip into the less shallow and the deeper end of the pool. But I hope many of you got to hear Luis speak, if not this weekend, at some time in the past or hopefully in the future. He's just such a dynamic speaker, and he's so passionate about this philosophy, and it's just a real treat, so make sure you get a chance to check him out. All right, so she actually was my first case, I should say. And I didn't know this going into this. We put her in a Motion 3D first, okay, because she was Class 2 Div 2, and put her into Motion first, and hadn't really decided if she was going to go into braces or aligners yet. So, so she ended up going to aligners. So it was my first, technically my first case, but real Class 2 Div 2. You know, I mean, just classic. Deep bite, flared upper laterals. You know, she had gone through 2 phases of treatment as a teen, and things relapsed. And she literally just broken up with her boyfriend a day before she came to see me. So she really is not happy in this picture. All right, so we're moving along with our motion. Okay, as far as progress here. Okay, it's 2 months in. Okay, and we'll leave her about 5 months in this picture. Moving along. You can see a good Class 2 correction happening. You can see some spacing opening up between her upper incisors. She's doing great. She's being very compliant. Although she did admittedly fall off the wagon just a little bit as far as elastic wear. So things aren't quite correcting as well on the right side as the left as they are on the left. But really excellent spacing between those upper centrals and laterals. Moving along, she's got some new glasses. She's starting to cheer up a little bit. Okay. So even though I'm not 100% corrected on this right side, like, you know, it's time. Let's move into aligners. Let's see if we can get the rest of that correction, that little bit, with the aligner. So at this point, we scanned her and sent off for the aligners. What I did was we made a temporary Essex, upper and lower, to kind of hold her until the aligners arrived. Oops, sorry, let's go forward. Wrong way. Okay. All right, so here was the day that, I believe this was the day that, okay. Yes, the day that we inserted her aligners. And what I really wanted to do with the system, since this was my first case with the aligners, I made 0 modifications to everything they brought back to me. 0. So I was like, I just want to really let these aligners work. I want to test it out to its true potential and just let it ride. So here we go. So things are moving along here, and I still had her wear her elastics. You can see I left the Kaplan hooks on the bottom, but I was a little worried about this right side kind of slipping a little bit. Left side stayed really well, but I was a little worried, you know, that this was slipping back into Class 2. So, you know, just had her wear her elastics, and I said that's all we can do to try to work it out. And the other thing I was getting a little bit nervous about is if you look at her upper right central, you can see it's tipping a bit, right? And I thought, okay, well, what am I going to do about that? I can't do anything. I'm just going to let it work itself out, and if we need to correct it with something else, we will. But so I'm just going to let it work and let it keep going. So this is 4 months into her aligners. So we're going along, and that tip in that central is starting to upright, okay? It's starting to correct itself, looking good. And so she's doing a lot better with her elastics on the right. And so that's coming along well. So, okay. Yes, all right. That's my gasping at the tip in that central, right? Okay. 8 months into our aligners. The tip has completely worked itself out in that central without any attachment, all right, without any auxiliaries. And, you know, her midlens are on now, and she's just about, you know, she's just about done. But I was just really impressed how well that plastic and how well those aligners just corrected that tip in that central. Okay, so I was clapping at that point. All right. So this is where we finished Miss Alex. So she was in her Motion 3D for 6 months. She was in her clear aligners for 12 months. And so total treatment time was 18 months. Okay. So she was all smiles, right? And she finished her treatment. She sent this picture to her mom about 2 months ago. She said, "Mom, I'm so excited. I love my smile. You know, thank you so much for all you've done for me." And her mom said, "I'm so pleased. I'm so happy." So her mom is now a patient. Okay. So I'm going to move on a little bit to treatment presentation to the new patient. For us, it starts with the new patient call. Then we go through, we do a scan and an exam, and then the TC does a treatment review. So you know how important it is to gather the correct information on a new patient call. Those patients that want aligner treatment, we obviously note that. We do a little different exam for them. When they come in, we immediately do an iTero scan, and we'll do an outcome simulation for them. What I'll do, the TC will explain to them the technology, and she'll show how the teeth move on the screen. I'll come in and I love to move things around. I love to use the technology, move the teeth around on that, on either the iTero itself or on an overhead screen, and show them, you know, this is all doctor driven. You know, this is how I'm prescribing your treatment. You know, it's important. It's not just a computer. You know, this is the doctor expertise behind this. And then I'll present my recommendations. And knowing that they are coming in for aligner treatment, I will explain to them, you know, the difference between Invisalign and SLX aligners, and I'll show them the two. This is great. We do tons of aligner treatment here. And, you know, in your case, I think that this would be a great option for you, because some of them come in actually saying the words Invisalign. And I'm not here to, like, do a bait and switch on them. I'm not here to, you know, pull the wool over their eyes. I want them to know that this is an aligner treatment. It's just not that brand. You know, it's like, just like Puffs or Kleenex. You know, they're both tissues, but which one are you going to use? They're both going to do the job. So again, you know, it can be the same treatment time, you know, the same cost. I just want to let the patients decide. You know, I want them to think that I'm not proponent, you know, being a proponent of one or the other, which really I try to lean them toward the SLX aligners, but 9 times out of 10, they'll just look at the difference. They'll just look at the aligners and say, well, why would I even want that? Why would I even want those bumps on my teeth if this can do the job, if they're clearer? So I'd let them choose, and we go from there. So I'll let the TC finish the treatment presentation. You know, we've already got their scan. They're ready to start. If they want to start the same day, we just can take some photos and a CBCT, and we're on our way. Now, as far as submitting the cases for the SLX aligners, you can either take an iTero scan or you can use a 3Shape. We have both in our office, so whichever's available, that's the one we'll use. To upload this and to submit this, you're going to go to the DDX, the Digital Dental Exchange, and this is where you're going to log in and get the case started. You can click on the Henry Schein Orthodontic tab here, and if you see the blue box there where it says Document Center, you know, that has a great, that's a wealth of knowledge there, great reference area, especially for first-timers. You know, there is a quick start guide, there are frequently asked questions, there's a printable aligner form if you'd like, and then it also has detailed exporting instructions for the iTero and for the 3Shape. So it's a great resource center for you. Also, if you want below the document center in the center where it says educational videos, you can watch videos instead of reading if you'd prefer. It'll take you through the process as well. There's also a form that there are 2 different ways actually to submit your case through the iTero, and you know, one is through myitero.com and one through myaligntech.com, and so this document will detail those very well for you. Okay, and so again, under the Henry Schein Orthodontic tab, this is where you're going to schedule and enter your new case. And you can enter the patient's information. And on the select procedure button here, the drop down, that is where you're going to select SLX clear aligners. This is sort of like a preference screen, right? So you can submit what you want to happen with the upper midline, lower midline, arch form. How do you want this? Do you want no IPR? Do you want them to expand first? Really detailed notes for the lab, and let them know how you want this case set up for you. And the EBT here, EBT stands for elastic button technique. If you do want any cutouts, because you want to run in some elastics, if this is a post-motion case and you want to continue to hold that class 2 correction or class 3 correction with elastics, this is where that you'll select that, and the little tooth chart will come up, and then you can select where you want those button cutouts. Takes about 2 weeks from the time you approve your case to the time that you'll receive it in your office, much like many of the other aligner companies. So when they come to your office, you can be super excited like I am here and stack them on your head. This was around Halloween sometime, so we have some makeup on our face, so that's why it looks a little odd there. But anyway, so they arrive, they come in this nice little box here. It's got 2 drawers on it, so a little sleek case there. And on the outside of the box, patient's name, the number of the aligners. And then inside the packaging, you can see the aligners are individually packaged. That's got the number of the aligners on the outside, the patient name. And then inside the box is also your IPR sheet and your tooth movement chart. So it kind of describes all the tooth movements that are happening in each tooth. And in addition to this, you're also going to get a set of retainers for the patient, and you're also going to get a nice little sleek case to hold all those aligners in. All right, so aligners are there. They arrive in your office. You can deliver them. Our instructions are wear them 20 to 22 hours a day. We're doing weekly changes with our aligners. The instructions in the box will say 2 weeks. They need to do that. They need to say that for I think FDA purposes, but you can do whatever you'd like to do in your office. We tell them to brush them daily with soap. And our famous phrase for our aligner patients, or even when we deliver retainers to our patients, is these should be in your face or in your case. It's a little mnemonic they can remember, and when they lose their aligner, we remind them, was it in your face? Was it in your case? Okay, that's why you lost it. So there's really no difference. You don't have to change anything in your office as far as aligner delivery, as far as instructions, and it's so fast and easy. You're not going to be placing attachments at this aligner delivery appointment. So there's very little doctor time. There's very little patient time. You can, scoot this into your normal routine. We do tend to deliver about 8 to 10 aligners at a time. Again, you can do whatever you normally do, whatever works with your rotation or schedule rotation, however you do it in your office. So again, you don't have to change much. It's very, very easy to integrate it into your office. Okay. All right, so today's goals, I wanted to help you understand what is it really about all these aligners, why are they why do we not need attachments with them? And so I was hoping that through, explaining the fabrication and design, that we answer that question for you, the what. And I hope you understand now why this is very beneficial to you as a doctor, but also to your patients as well. And to learn how you can easily integrate this in your practice without disrupting your normal patient flow and your normal systems in your practice. So with that, your takeaways, I hope you learned the patient benefits, the doctor benefits, and how easy it is to integrate this into your practice. So with that, are there any questions? All right. Thank you.
All right. Thank you, Dr. You learned a lot about our aligner system.